Hi, I'm Dr. Akash Shukla, Director Hepatology at Sir H.N. Reliance Foundation Hospital, Mumbai.
Hi, this is Dr. Ravi Mohanka, Director of Liver Transplant and Hepatobiliary Surgery at Sir H.N. Reliance Foundation Hospital, Mumbai.
Greetings from both of us on the occasion of World Liver Day today, and wish you a very happy and healthy liver for the future. So, Dr. Ravi, for our audience, I would want to start by asking you, what are the functions that a liver does? Why is it so important?
So, a liver is a very important, most important organ in your body. While most other organs such as heart and brain and kidney, they each do one function. Liver does multiple functions. Some of the most important functions that the liver does, one is it makes all proteins in the body. For example, the muscles, the antibodies that protect us from any infections, and proteins that make your blood clot. All these proteins are made by the liver. The second type of function that the liver does is detoxification. So every food we eat and every medicine we eat, to detoxify that is done by our liver. And then the third most important function the liver does is to keep the pressure of our abdomen under control. Just like we have what is called as hypertension, which means your blood pressure increases. Similarly, the blood pressure of your abdomen, inside your abdomen, of the blood vessels inside your abdomen is maintained within normal limits by your liver. So these are some of the most critical functions done by your liver.
Right. Thank you. Thank you, Dr. Ravi.
So I would like to ask you, Dr. Akash, what are some of the most common diseases of liver that you see and some of the symptoms that patients come to you with?
So, what we have seen, Dr. Ravi, that, everybody is aware that alcohol is a very common cause of liver disease. But now we know that there are many other causes of liver disease. There are, in fact, over 300 causes of liver diseases. The commonest today that we see are hepatitis B, hepatitis C. Then there's something called as non-alcoholic fatty liver. Today it is very common to see a person walking in with a report of, ultrasound, which shows that there is fatty liver. And in fact, estimates are that almost 1/3 of India has got fatty liver. Now, of these, almost 20% are at risk of developing complications because of this in the future. And not only is this fatty liver important for the liver-related health, but it also tells you that you could be at risk of many other diseases which are part of the metabolic syndrome, like heart disease, blood pressure, snoring, what we call as obstructive sleep apnea, gallbladder stones, cancers other than liver also. So all these things can be related to the fatty liver. Also, there are other causes of liver diseases like autoimmune hepatitis, where body's own immune cells, instead of attacking and clearing the bacteria, the fungi, the virus, the foreign particles, they actually attack their own liver and tend to cause damage to the own liver. So that is again something which we are seeing on a rise. And there are again metabolic disorders, genetic disorders. So there's a whole gamut of liver diseases which can come. Now, the problem is most of these liver diseases are silent. Unless there is you do a specific test like blood biochemistry, the LFT, what we call as commonly, where you find SGOT-PT to be high, or you do an ultrasound which shows some abnormality, or you do specific tests like fibroscan, which will detect how stiff the liver is or how much is the fat in the liver. Unless we do these tests, we cannot pick up these diseases early. Once the diseases develop symptoms, it is almost always a very advanced stage. And that stage is called as the stage of cirrhosis. And at that stage, the symptoms are usually yellowing of the eyes, accumulation of fluid in the tummy, swelling of the feet, vomiting of blood, or the detox function gets compromised. So the ammonia levels in the blood increase, and that causes brain dysfunction. So patient becomes confused, drowsy, and can even slip into coma. So these are the various causes of chronic liver disease. There is also an entity called as acute liver injury and acute liver failure. So very often patients will come with just jaundice for last 10 days, 15 days, yellowing of eyes, dark urine. That is what is called as acute hepatitis. And that is usually caused by hepatitis A or hepatitis E. And that gets treated very simply with just symptomatic therapy, and most patients would not require any prolonged therapy. A very small subgroup of these people can develop a severe injury. And their severe liver injury can actually progress to coma and even death. And that we can identify by doing a very simple test called as INR. So if the INR is high in a person who has got jaundice for a short period, then that tells you that this patient requires a significant attention. So if you can identify those groups, then those patients will require a ICU care and a high-end treatment. Otherwise, for most people with a short history of jaundice, they can be treated simply with medically. Dr. Ravi, I would want to ask you one question at this stage. We have been dealing a lot with liver cancers, if you see, for the last few years. And how do you think we should, can we identify the liver cancer early? And how we can treat them, the liver cancers?
So liver cancers are very easy to treat once they are diagnosed at an early stage. Unfortunately, liver cancer also suffers from the same problem, is that they do not produce any symptoms, or even if they produce any symptoms, they are very non-specific, such as not feeling well enough, maybe having some weight loss, so things like that. So it's not a very specific symptoms that the patient comes with, and therefore it is often difficult to diagnose liver cancer because of symptoms. A lot of times patients get diagnosed with liver cancer either because they have a known liver cirrhosis, or they have known hepatitis B infection, or they have undergone an ultrasound test as part of a screening test either for some other disease or as a part of their health checkup. Now, once they develop liver cancer or they get diagnosed with liver cancer because of any of these reasons, then typically, if it is early stage, then we have a lot of options. Then we can treat them with what is called as RFA, where we can burn the tumor with a special type of needle, or we can give chemotherapy or radiotherapy. Now, the chemotherapy or radiotherapy that is given for liver cancer is very different from a routine chemotherapy. So, you don't give it into the veins. You give this chemotherapy or radiotherapy directly into the liver. This is to avoid the side effects of the medicine and to maximize the effect on the tumor. So this type of chemotherapy and radiotherapy are called as TACE and TARE. Apart from that, we have surgery in which we can do a resection. So we can remove the part of the liver where the cancer is, or we can even change the whole liver, which is the transplant. That will not only take care of the cancer that is present in the patient, but it will also almost eliminate the possibility of new cancers developing in the patient. Because every patient who develops liver cancer because of liver cirrhosis or because of hepatitis B has a high chance of tumors coming back in the future despite treating them initially. So therefore, depending on the patient's tumor size, where it is located, what type of tumor it is, we generally will choose amongst one of these treatment options. But they are very difficult tumors to treat if they become, or if they come to a doctor at an advanced stage. So that is a major problem with liver cancer. So Dr. Akash, one question for you. So, once you see a patient with liver disease, so maybe on one end, let's say a fatty liver disease, on the other hand, you see a patient with liver cirrhosis. So what is your treatment plan, or what would you advise to a patient who will come to you only with fatty liver, and to another patient who comes to you with how would you treat these patients?
Yeah. So many of these diseases have a specific treatment. Like hepatitis B has got specific medicines which can be given, which are simple, safe oral medicines which will control the disease very well. They are very safe without any side effects. Similarly, you have medicines for hepatitis C, which you can cure now. For last 8 years, you have medicines with which you can completely cure hepatitis C. In addition, for patients with autoimmune hepatitis, for Wilson's disease, and many other metabolic disorders, we have got medications which are available with which we can treat and even reverse the disease. Now, fatty liver is something which is a very unique disease which is not just one particular problem of fatty liver. They usually have what is called as metabolic syndrome. So they will almost always be with obesity or with, diabetes, hypertension. So when it is just fat in the liver and that fat has not caused any damage to the liver, then all we need to do is control the lifestyle and treat all these comorbid conditions. But as this fat in the liver becomes inflamed, it turns rancid, it starts causing damage to the liver. And over a period of 5 to 10 years, 15 years, 20 years, it will progress to fibrosis and then eventually cirrhosis. Now, in those people where it is progressing, there are now specific medications which are available, which can be used to reverse the damage also, as well as prevent further progression. However, once patient develops cirrhosis, full zone cirrhosis, and cirrhosis has got 3 stages. The first stage is called as compensated, where the liver looks hard, it is irregular in shape, but functionally it is still doing all the important functions. The second stage is called as decompensated cirrhosis, where you start getting compromise of the critical functions like accumulation of fluid, blood vomiting, jaundice, and hepatic encephalopathy, that is affection of the brain. And the third stage is where the liver fails completely, what is called as liver failure. So these are the 3 stages. In compensated stage, you can still treat and reverse the damage. In decompensated, if you can find it early in the decompensation, you can still treat these patients if you have a specific treatment available and reverse. But once you go to the advanced decompensated stage or liver failure, then liver transplant is the only option that is available. The key is that you should transplant the patients late enough to justify the transplant and yet not very advanced where the outcomes become compromised. So the timing becomes extremely crucial. So it is in the decompensated stage that you'll think of doing transplant when you cannot reverse the primary cause. Now, Dr. Ravi, there are a lot of misconceptions which people have about liver transplant. That, that people think that if transplant is done, very low chance of success. Second thing people feel is, once a transplant is done, they will have to be isolated and they'll have to live in a glass house. They cannot eat anything outside. They cannot attend parties. They cannot go and watch matches or watch movies. So can you just tell us about the journey of a patient after transplant?
Sure, that is very interesting because you're right. There are a lot of misconceptions. And the first successful transplant was done almost 50 years ago now. And from those 50 years, there's a lot of misconceptions that have been carried from those era actually. So currently, liver transplant is a very routinely, regularly and successfully performed operation, not only in India but all across the world. In India itself, there are about 3,700 transplants that were done last year. So it's a very routinely and very successfully done operation. Now, all these transplants are done for very stable patients also and very sick patients also. So, if you look at the overall success rate of transplant, it is 90% plus now. And especially if you look at the stable patients, it's probably 95%, around 95% or more now. So, the success of liver transplant has gone from around 70%, which was about 20-25 years ago, to about 90 to 95%, which is very successful. Second thing, after the transplant, the patients have to, of course, recover from an operation, and it's a big operation. The operation itself is about 10-12 hours, but it could be shorter or longer depending on how difficult it is. Typically, patients will stay a few days in the ICU and about 1 to 2 weeks in the hospital. After that, they live practically a normal life. They have to follow a few precautions, such as they have to eat hygienic food, they have to avoid contact with people who are sick. Other than that, they can do all their work. They can participate in sports. In fact, there is a team of athletes from India that has gone to participate in the World Transplant Games, which is like Olympic Games transplant. About 32 athletes who are post-transplant patients have gone to participate in that to represent India. So, all this is routine. We have patients who have undergone transplants about 15 to 20 years ago, And we have patients who are athletes who participate in marathons and various sports. We have patients who are doctors who see like 50 patients a day now. We have movie directors who work for more than 18 hours a day. So we have a lot of success stories, and it's such a pleasure to see patients who do so well after transplant. So there is absolutely no need to worry about transplant anymore as it used to be in the past. So it's a very successful modality. Patients who need it, they should undergo it without any fear. In fact, a lot of transplants are done from living donors, which means one of the family members is the donor, and even their surgery is very safe. So not only the patient does well, but the donors do exceptionally well. So the liver will regenerate back to normal size in 3 weeks time. After that, they are as good as they were before the surgery ever happened. So overall liver transplant is a very successful modality for treating liver failure, and their not only lifespan but the quality of life both see a very significant and exceptional change. And patients who have undergone transplant, they understand what I'm saying. So they have a sea change in their life, not only the expected lifespan, but also the quality of life. So it's a very successful way of treating liver failure. And for patients who need it, they should not have any fear of undergoing it.
So some of the newer technologies which we are using these days, so in surgery, what are the techniques that you're using? What is the basic?
We have some of the most amazing technologies that are not only available with us, but also upcoming in our hospital. So not only we do liver transplant, which is got all these technical equipment and all that we use, but we're doing laparoscopic liver surgery for liver cancer, and also for donor surgery, for living donor surgery. And also we use robotic surgery for both liver cancer as well as for transplants. So there is a lot of interesting things that we do use of technology during the surgery. One of the most interesting and promising things that we have coming up recently is one of the ultrasound machines that we have bought, which synchronizes with your CT scan or MRI machine, and then it provides real-time navigation during the surgery. So this is a technology which currently is only available in this hospital in India. What about you? What is the new technology? What are the new technologies you use in hepatology?
So I think we have got some very fantastic equipments which we are using, which will help us manage our patients better. One of them is something called as FibroScan 630 Expert. There are various FibroScan models which are available, but this is the world's most advanced model. And why this is unique? It not only tells us the stiffness of the liver, that is a stage of the liver disease, it also tells us how much is the fat in the liver. But the most advanced part of this machine is it tells us about the splenic stiffness, which is what tells us how severe is the portal hypertension. Like how you mentioned in your surgery, one of the functions of the liver is maintaining the pressure. So if the pressure of the abdomen increases, how do you measure it? It's very difficult to measure. So this is something which will measure it from outside only, just like an ultrasound machine. You just put the probe on the spleen, it will measure the stiffness of the spleen, and it will give you the value as to how much is the pressure. And that can help you even avoid endoscopies and sometimes tell you that now an endoscopy is needed. In addition, we have also got a wonderful tool which is called as a bioimpedance, which will tell us about the exact body composition. Very often you will find people who are very lean and thin, and they still have grade 2, grade 3 fatty liver, and you start wondering why. Or patients who have got fluid accumulation, you have given medicines, but the fluid is not coming down. So in these people, it helps big time by doing a body composition analysis, exactly how much is the muscle mass, how much is the fluid in the extracellular compartment, how much is the fluid in the intracellular compartment, and it will give you the exact details which will help you manage these patients much better. So that is a very unique thing that we have, which has made it much better for our patients and improve their quality of life.
Wonderful.
Thank you, Dr. Ravi. With that, we conclude our Facebook Live session. I hope that this interaction was helpful for you. We wish you from Research in Reliance Foundation Hospital, from the entire liver unit, the best wishes for the next year. We hope that you take good care of your liver and live a very healthy life. All the best.
Thank you very much.